So good evening, everybody. I welcome you all to this session of ORPI. This is Ophthalmic Research and Publication Initiative on behalf of EIZOC. So this program we have started 2 years back with Dr. Chaitra as the mentor for this program and Dr. Santosh as the coordinator. Now we are successfully continuing this now and we are conducting under EIZOC banner. So I welcome you to this program. We are very lucky and fortunate to have Professor Rohit Saxena with us. He has vast experience in teaching postgraduate teaching particularly. And the topic today we have decided is writing thesis protocol. As new residents and postgraduates have joined recently, it is very much important to know on the protocol because the protocol is the essence of doing and writing the thesis. If you have done or if you have written your protocol properly, it makes things very easy to conduct the study subsequently and also to write your thesis. You won't feel like a burden of writing the thesis. So I think we will all learn a lot from his experience and from his deliberations. So with this brief introduction, I hand over the program to Professor VNR Subudhi, the Chief Coordinator of this program. Thank you all.
Thank you, Dr. Patnaik. So let me share the screen. Mr. Mosam, am I visible?
Yes, sir.
Okay. Thank you. So again, as Dr. Patnaik has already told, we are doing this program since last 6 to 7 months on the EIZOC platform. This Ophthalmic Research and Publication Initiative, this is series number 9. And today's speaker is Professor Rohit Saxena. So this is the team, our team of this ORPI, and today's, I think it's the 9th session, and I being the chief coordinator for this program, we have got advisor Dr. Ajit Babu Maji and my co-coordinator Dr. Santosh Mahapatra, and with our mentor Dr. Chaitra Jaydev. She is with us since last, I think, 2 to 3 years in these programs, and she never failed in coming to this program. Always is with us. Thank you, Dr. Mentor, Dr. Chaitra Jaydev, for your guidance for this program. And of course, the EIZOC team who has given us this platform to broadcast this program. President of EIZOC, Dr. B.N. Gupta, Secretary EIZOC, Dr. Suraj Bhattacharjee, and of course, Chairman Scientific Committee, Dr. Sabhishaj Patnaik. They are always encouraging these programs for the students. And regular moderators, Dr. Prafulla Maharana, Dr. Natasha Das, in almost all our programs of ORPI, they are with us. They will be also joining a little late. And of course, today's speaker, Professor Rohit Saxena, is really young and dynamic, as you see from the picture. So he is the presently professor at RP Center, AIIMS Delhi. And after completing his MD course in ophthalmology at AIIMS Delhi, he joined the faculty as assistant professor. Since then, he is now in the professor in the AIIMS Delhi. And he has completed his PhD also in 2016. Of course, as I told you, the academic qualification, already he has got MBBS, MD, and PhD. His main interests are strabismus and pediatric ophthalmology and neuro-ophthalmology. And of course, phaco is a common thing in everywhere. So in all any faculty, phaco must be there. So he is also a prolific phaco surgeon. And he has got a good number of academic achievements. He is the principal investigator of numerous funded and non-funded research projects in AIIMS, published more than 130 indexed publications, authored 2 books and written 32 chapters in national international books, attended and presented at more than 250 national conferences and CME, and in 21 international conferences, including the performing life surgeries too. And reviewed for the last 10 international indexed publications also, has received more than 30 awards for research and academic contributions. In the last 6 to 8 months, I got the opportunity to see him in almost all the conferences of our state conference of our India. So I welcome with this all his academic qualifications. I invite Dr. Professor Rohit Saxena to speak today's episode of writing a thesis protocol. We have done this program before also, but every time we learn new things because a lot of speakers have come and most of the new things. Graduate students, they learn, and today being again a new batch of postgraduate students have joined in almost all the medical colleges of our country. They will be learning how to write a thesis. So today's panelists being Dr. Sarmishta Behra from Bimsar Burla, Dr. Chandra Chakravarti, RIO Kolkata, and Dr. Anita Ambata, RIO Patna, Dr. Sabita Devi from FDC Medical College, Barampur. These are our panelists today. They will be interacting with our speaker and moderators. Of course, today it's a galaxy of discussants that the postgraduate students from almost all over the country, mostly come from the EIZOC states. So these are 9 postgraduate students will be interacting with us, and I request our speakers, panelists to ask questions to these postgraduates, how much they learned today at the end of the session. So these few words, I welcome you all to this session of writing a thesis protocol, none other than the speaker from AIMS, a highly qualified person, Professor Rohit Saxena. So welcome you all to this program. Thank you very much. And also I welcome the viewers also. They have also joined with us. So now with a few words from our mentor, Dr. Chaitra Jaydev, then it will be over to Dr. Rohit Saxena.
Thank you, sir, for giving me this opportunity to be a part of ORPI. It's been a great learning experience for me, listening to these fantastic speakers that we have been having every fortnight. I think, like you mentioned, we have done writing a thesis protocol before, but I'm sure Rohit, who's a very good friend, is going to bring a lot more inputs. And he being from the Apex Institute, I think he's handled so many more students, and every year he has brings in more and more experience. So it'll be a pleasure to hear you, Rohit, today, and I'm sure you're going to add a lot to our young postgraduates here. Over to you, please. Thank you.
Thank you, Chaitra. Thank you, Dr. Subudhi, not only for a very fine introduction, but also calling me young. Of course, and it's been some time since I can really, kind of count myself among the young only. But anyway, my screen visible?
Yes. Yeah.
Yes.
So,
Yes.
Thank you, Patnaik, Dr. Subudhi, for giving me the opportunity to be here. It's a wonderful initiative to get our residents to interact, to learn about how they can best perform in their residency program, because that's the kind of foundation on which their entire next 40 years of career as an ophthalmologist is dependent. And one thing, of course, you can never choose in a thesis protocol is choosing the right guide. But you can see there are here on this photograph some of the most intelligent, most capable, and definitely among the nicest people, particularly Dr. Patnaik, Dr. Subudhi, Chaitra. So all of them are very nice people, and a guide can't be better if he or she is not only guiding you and teaching you, but also being your friend. So these are important aspects of a guide. But of course, like I said, you can't choose. So we'll stick to what you can do during your residency to write a thesis protocol. So first question is, why should we actually be talking about thesis protocols? The most important is, of course, that it is an essential requirement. Now, many times, and this is something I've also had frequently among my residents, they seem, and I've been a resident at RP Center, and I know how I also used to interact. So I would see my guide coming from the opposite end of the corridor, and I'll quickly rush into one of the rooms trying to show I'm so busy and preoccupied that I kind of missed looking at him. So I also see these kids, looking at me and going left, right the moment they see me, and they think that, my field of vision is so poor that I would not have noticed this. But I keep telling them that, this is an essential part of passing. What you learn today or you don't learn, it's important that you learn. These are best places to be educated, and what you learn today, you're going to use in the next 40 years of your clinical practice. But those are optional learning experiences. But essential is do your thesis, however good or bad it may be. So that's like the essential part of it. The other thing is that today, in today's world, everybody is forced because of not only medical legal issues, but also because there's so much information available and floating on the net, some right, some wrong, but a lot of information is going around. So what you practice should have a basic scientific method to it. And a thesis writing, creating a protocol, doing a research is your first exposure to a scientific method that's going to keep you on track and make you question each and every action, because that's what a scientific method is based on: to ask, to question, and then to implement what you think is correct. Then, of course, it gives you an opportunity to present and publish. And, while it may seem a very poor, replacement to good cash in the bank, but yeah, I mean, every time I see my name, even now in a good indexed publication, or I see a publication of mine making a difference to clinical care, it obviously makes me feel very proud. And finally, you are contributing to the academic committee, that we say that, every brick will make the wall. So every little step we take and we publish is, the essence of these years and years of change that, ophthalmology is developing and finding. So every little thing adds on, and people will get ideas from what you have done. And maybe your research may not be, your thesis may not be that, path breaking, but you must publish and somebody hears about it and may get a better idea. So all these things are, what sustains us. After all, medical field drives us and encourages us and gives us that challenge that probably no other field can. And publishing and doing some outstanding research that can change lives is what I feel one of the best things that, research and even clinical brings to us. So let's getting that why out of the picture. What all are the things that are involved in doing, in creating a good thesis protocol, and of course, going onwards to do that? You select the topic, write the protocol, plan and monitor your thesis work, write the final thesis beyond the endless possibilities that good research can bring for you. Thing is a good research question. So the first thing is, I need to think what I want to do. I always encourage my residents to come with what they want. I mean, of course, I tell them that my specialty is pediatric ophthalmology, strabismus, and neuro-ophthalmology. And if you, come to me with a retina topic, then I'm sorry, I'll probably ask you to change your guide. But within the realm of my specialty, go read, look up what are the new hot topics, and then discuss. It should be your thesis, so it should be kind of decided by you, but guided by me. So first question is, it should be feasible. I mean, whether it is a possible thesis to do in the resources that we have available, in the time and the affordability and the money or the opportunity that you have available in your institution. And of course, it should be fairly manageable. That should not be the only thing that you're going to do, of course, in your MSMD program. It, of course, should be interesting, should keep you interested, so that you don't feel it's a burden, it's a waste of time. There should be an adequate novelty to it. So while invariably we are doing kind of repeating research done elsewhere, or kind of proving ideas that others have done, but still there should be a little novelty to what you're doing. Either it's in a different age group, it's in children if it was done in adults, or there is a little difference in the kind of cases in which we are going to use. So there should be a little novelty to the work that you're going to do. Not only it keeps you interested because there's a question, a real new question you're going to answer, but also once you eventually want to publish it, it is accepted and people are interested to read and know about your new finding. The bottom line of any research or anything that you do, and the day you have entered MBBS, the most important part of everything that you do, that it should be ethical. You will on a daily basis be asked to be judged on ethical standards, and you should never be found failing in them. And we'll discuss a little more about ethics as we go along in the thesis process. But the next most important thing is that it should be relevant. I mean, it should be a thing that we can actually, kind of talk to about people, that, see, I'm doing this, and I hope that if I'm able to do something good, I'm going to be able to change lives, make an impact, do something for the, bring about a change. These are ways that, you can make your thesis interesting and keep yourself involved in your work. So these are what are, these are what are called the finer points of a good research question. Then, like I said, eventually a thesis topic is not going to be all that great, but the most important thing is it should be relevant and for the time. like ECC versus SICS versus plaques is not a thought that we're going to actually kind of put into implementation now. It doesn't help us all that much. Nobody wants to know about it anymore. Yeah, SICS versus phaco, maybe. So we are looking at it because there is a lot of surgeries of different types, and both of them have given us good results. So you need to be in with the time as to what you want to do it about. It should be, like I said, practical and doable. You build on previous research, groundbreaking and cutting edge. So again, it should bring about a change in the way we're going to practice or our knowledge. And of course, all this is based on reading a literature review, finding out what has been done, what I'm interested in, what are the areas that I could work on, and then brainstorm among yourself, with your friends, or with your guide. The next is the PICOT. So when you are designing a study, it's the PICOT that is important in how to design your study. So what is your population or your participants or your patients you're going to do a study on? So adults, children, males, females, area localization, a particular associated problems that they may be having. So it's your population on which you are going to do your study. What is your intervention that you're planning to do? It may be an active interventional study. It could be an observational study. But what is it that I am planning or trying to do in this group of population I'm looking at? Am I going to compare? It always is better to compare because you're going to get, you'll be able to statistically compare. And finally, all medicine is statistics. There is, I mean, while we are taught in school that, you know, if you're good at maths, take engineering, if you're poor at maths, take medical. But frankly, the entire medical treatment facility is based on statistics and nothing else. You're going to compare, you're going to find means, you're going to find averages. So this is what is the next thing. How I'm going to compare and find out that are these patients different from the rest or the other group or the other set of patients. So comparisons become important when you're looking at how significant your findings can be. Then what is your outcome? What are you looking at in your research? What is the outcome measure you're measuring, you are identifying, you're expecting that will change by your intervention or whatever procedure that you're looking at. And finally, what is the time duration? So you need to know how much time you have for your thesis and how much time you will give for enrolling, for follow-up, and finally for analysis. So all this has to be, you know, kind of factored in when you are designing your study or planning your designing a study protocol. So a thesis topic can be vast and a huge array you can look from, but like we started off with, it should be feasible and available resources and time frame should be there for you to complete your thesis. And finally, it should be possible for you to arrange for the sample size and be able to analyze the data. The other important thing is, of course, when you're doing animal or human studies, as I mentioned, ethical requirements are necessary. And of course, you don't need to do the same thing again and again in that same institution or something that has been very easily done. Look for a little more novelty in the work. It could be the same idea, but in a different group of patients where you really want to see how a particular intervention or an idea makes a difference. This is your overall protocol format. You have to have a title page, a certificate from the institution about permitting you or whatever the opportunity you're getting, ethical approvals, introduction, lacunae, review, aims, objectives, the meat is the materials and methods, which is what the real protocol is all about. It's what I'm going to do and how I'm going to do. So your aim is that this is what I want to do. This is what I aim to get. Your material and methods are going to tell us how I'm going to achieve that aim. Whether what I am doing is going to answer that question that I'm starting off with. So these things are, all these parts are very closely connected with each other. And finally, on all this, of course, comes from a good review of literature. Your introduction is about the background of the program, that what is known, what is not known. And because of that, my aim is this. And finally, this is the way I'm going to actually answer the question I'm going to start off with. So, I mean, talk to your seniors, evolve over time. The protocol is the most important part of the thesis, maybe I mean, just next to actually doing the work or collecting the patient data. So it's most important, because you start off with the wrong protocol, or you start off with a method that's not actually going to answer the question. And 1.5 years down the line, when you start writing, you realize that all I needed to do was maybe take this one more factor, or look at this one more thing, and I could have had a great result. And right now I'm just struggling to make sense of the data I have collected. So talk to it, evolve your protocol, discuss, critically analyze it, present it, or talk about these ideas to other people, get them to criticize your protocol so that you are able to make a final protocol that is looking at something new within the realm of feasibility. Always discuss with the statistician. It's very, very important, because again, you do a study that is not powered to, give that answer that question. You're just going to end up with that we found, however, was not statistically significant. It looks, or it appears. All these are ambiguous terms. So involve a statistician, get your protocol powered, or your study powered to answer the question that you want to find out in respect to the sample size, and therefore have an idea of how you're going to collect and analyze the data. And of course, a thorough literature review is very, very important. So your introduction should be about what you are looking at. Briefly mention the thing that you want to work on, like strabismus. So what is strabismus? What are the problems, or what is the particular condition in strabismus I'm looking at? What is known about this condition? So if it's Duane's, strabismus is this, Duane's is this, these are the gaps, this is what I don't know, and therefore this is my research question. And so in the back of the mind should be that this is the question, and if I'm able to answer this, I'm going to be able to add something significant to our understanding to this disease. Again, it should be a little continuous. The flow should be good. It's like a good novel. So the person who's reading it should be interested to move forward in your introduction and the flow. So it should flow from one point to another. The next thing is the review of literature. Understand and concise your review. It's not just listing everything that is known. It is picking out. So it's not a documentation of available information on the net. It is reviewing literature, highlighting, bringing together what is relevant, highlighting the lacunae or in the available information, summarizing the data that is there, identifying the gaps, and therefore moving towards what is the rationale of the study. So why or what is the study going to be all about? It should be comprehensive yet relevant. Do not keep adding studies because you want to just inflate the number of papers that you're going to submit for your protocol. It should be interesting, adequate, and flow towards trying to show why or what is the rationale for your study. So review tips, review of literature tips would be, do not include just copy and paste. Do not make a whole paragraph out of something. So you need to have the highlighted points, make the obvious facts available there. List it preferably in chronological order, because that's how research has added information to the whole knowledge base. Try to keep it recent. There's no point in discussing things that happened 30, 40 years ago, because they are not probably going to be relevant to today's literature or today's study that you're going to do. Try to write in your own words, because finally, whenever you publish or whenever you write, it has to be in your own words. It should not be copy-pasted from any source. And of course, give appropriate referencing. Always give the due to the person who is published or given that idea, because it's very, very important. And that is the way in which the research and the studies have evolved. Identify the lacunae in the available knowledge. So again, it's important that it should be framed or written in an appropriate manner. Do not write that there is no work, there is no evidence, because one, you do not know that there is or not. You are of course not going to do the most exhaustive, most comprehensive search for that information. So you're going to broadly look at one or two couple of major sources. You're going to do PubMed. Sometimes you may even Google it. But again, Google will throw up some 10,000 hits, and you're not going to go through all the 10,000. You're probably going to go through the first page. So there may be some information, you're not sure. So you need to write things like, to the best of my knowledge, there is a paucity of data. There appears to be there does appear to be a lacunae. So, of course, you need to hedge it, but you can't be too, what should I say, apologetic about it. So you need to write that there doesn't appear to be enough information on this, and that's why I want to go ahead and do this. Your referencing should be, as it is called, the Vancouver style. I'll just show you. That's important. The way we are going to write, the authors, followed by the title of the article, followed by the title of the journal, the year of the publication, the volume, and then the page numbers. This is so that anybody who reads through your protocol can actually cross-check and find out what is given in your review of literature and what is the original article all about, where you have taken it from. Again, do not copy-paste, read it, understand it, and write it in your own words while referencing. I'm sorry. Yeah. So then we move on to the aims and objectives of your study. So the aim would be, what would I want to achieve by this study, or how the study would address the bigger issue that is existing. So the aim is broader, talks about what you want to achieve or what you want to do. The objectives are exactly what you want to do in this study. So they have to be very specific. They have to be measurable, achievable, realistic, and time bound. So you need to be smart in your objectives. You need to be sure what exactly you are going to come out, because in the end, your study outcomes are going to be assessed against the objectives of your study, whether your study was able to reach the objectives that you set out to or not. So the aim is the broader goal. The objectives are the fine commitments that you are making at the start of your study about what you're going to do in this study. So just an example, I'll be assessing macular function in acute central serous retinopathy. But objectively, I will look at the electroretinogram changes, or I would look at the MFERG. So these are specific objectives to a broader aim of assessing macular function. So just like you have a big goal or an aim, and you have very clear, precise objectives which have to be kind of followed, or which have to be achieved by your methodology, which is now the meat of your protocol. So where will your study be done? So this is defining the place, your institution, most likely. What is the duration of my study? So I'm going to look at a 1-year follow-up. I'm going to look at a 6-month. Enrollment period is 3 months, followed by a observation or follow-up period of 6 months. What is my design? So whether it's a case controlled, a cohort, a randomized, non-randomized, these are terms that you have to write at the very beginning, defining the type of study you're going to do, your sample size, and justification for sample. It's important to remember that not only should I not have a small sample, because it's not going to answer what I'm asking, and it should not be unduly large. Firstly, because it's going to put a lot of pressure and load on you. And secondly, it's actually not ethical or justified to do a very large group of patients when you can do with just a smaller group of patients. So wasting resources is also not a very good idea. So your sample size estimation should be there, done at the very beginning of the study. Again, going back to keep in touch, interact with the good statistician who will be able to help you to do that. So minimum work with maximum bang. That's what sample size brings for you. A study sample. So what is the sample that you're going to look at? What is your inclusion and exclusion criteria? Your exclusion criteria should not be just the everything other than your inclusion criteria. So I'm going to look at adults over 18 years of age. So I will exclude patients or children less than 18 years. That's not a good inclusion exclusion criteria. When you say I'm going to include above 18, it obviously means you're going to exclude those who are not in that age group. So an exclusion inclusion is just not opposite of each other. Your exclusion should be that I will be looking at, I will exclude, say, diabetics or patients with comorbidities, patients who are unwilling for follow-up, so, or who will not be able to sit through an entire field's assessment, or if my follow-up period is long, who will be unable to follow up. So these are your ways in which you are going to discuss or decide or show what is your study sample. Method of selection, how are you going to select them, where are they going to be recruited, and how are you going to randomize them. Then interventions, if any. So whether it's an interventional or an observational study, how you are going to intervene, how are you going to, what is your method in which you are going to assess, what are the things you're going to assess, and then finally, what are you going to intervene with. Your outcome measure, again, I talked about from the beginning, it's very, very important because that's the measure that is going to be evaluated, assessed, analyzed, and will give us the answer to the very question we started off with. How are you going to follow up, your tools for assessment, and then finally, gross writing or a little bit about how you're going to manage, store your data, your statistical analysis, and of course, again, last but probably the most important, ethical issues about ethical clearances, about informed consent, and of course, registering on the CTRI an interventional trial if you are doing an interventional study. So there are various ways to calculate sample size. They're of course available on the net, but again, you should always rely on a good biostatistician to be able to help you to understand and come to a conclusion about your sample size, and of course, discuss how you're going to do your data entry, what are the gross methods you're going to apply for, so that you're able to handle the data that you're going to get and of course come to a good answer. Consent again is a part of ethical clearance, and you'll never get an ethical clearance if you don't have a patient information sheet and a consent form. Both in, of course, it depends upon where you are from. For us, it's English and Hindi. It could be the regional language wherever you are working. So it's important to have it in the local regional language, which the patient can understand. And the patient information sheet, again, it's important to be very clear what you need to write. I am in the ethics committee and I come across a lot of very poorly written patient information sheets. Remember, it should be in a language, in a method that the patient can understand. It should not be a copy paste of the method section of your protocol. You need to talk about the study so that the patient is able to understand what we are going to do and what is expected out of him. It should be brief. It should contain contact numbers of yourself if you are, because you are going to be the key investigator, but of course, anybody else who may be there in your place if you're not going to be able to take the call, sometimes because you're in OT or maybe in OPD. And anything that you're going to do, any new method or anything that you're going to intervene, please mention in a bit why you're going to do and what are the problems that they can expect. So these are important patient information sheet information that must be given. Do not think that if I inform the patient, he's going to run away. Patients now are very intelligent and understand that they are part of a study, but they also appreciate that they are informed about things and they should be aware about. And from that comes the consent form. So once the patient information sheet has been administered, patient is expected to give a consent as a signed consent in front of a witness. And of course, if you're going to do study among children, a pediatric consent is different. You need to have an adult legal guardian who's going to give the consent, and along with the legal guardian consent in 7 to 18 years, an assent form signed by the child is also important. This we had gone back to, and this comes back to again the protocol format. These are very, very important components. Remember, it is essential to follow this protocol format so that your protocol flows from one to another. Again, highlighting the importance of the institutional ethics committee, that is the most important part before which you can go. Some general instructions about writing a good protocol, number pages, do not have a very long protocol. Again, you can increase the length infinitely if you keep adding information on review of literature or keep on in detail describing the instrument. But if it is generally known, your instrument or your method, try to keep it concise, brief, and interesting. Do not have too many references just to again add volume or bulk to your protocol. Have a standard. Of course, every place has a different rules regarding the way you're going to write protocol. So your font size, it should be pleasant to look at. It should not be very tight, very close, or very broad, very spread out that people think that you're unnecessarily ballooning your protocol. So it should look presentable. Remember, Presentation is 50% of, acceptance of anything. So if you present your work nicely, even I've seen average papers get published, but a great paper written in a very poor form just gets rejected just because I'm struggling to understand what this person has written. So remember, a protocol will just go back and forth from your guide and maybe from where it's gone for review. If there is a review process in your institution, unnecessarily, if it is not written in a neat, concise, yet informative manner. So the next is planning and monitoring your thesis research work. That is, how you're going to go beyond. So this was, my protocol has been written, but just to move forward a little bit about what is expected out of you in the next subsequent, period, how you're going to approach your research work. The important thing is always keep your inclusion criteria up front whenever you start patients. Discuss it with your guide, inform and keep it in display in wherever your patient can come. So if you have a place, a clinic, a specialty clinic or a OPD or a place where you want patients to come, but it's likely that a lot of patients will go to other faculty, other residents, other co-workers, keep a note of your inclusion criteria there. So while you encourage them to send all patients of, say, Duane syndrome to you, you still have an inclusion criteria that, look, I'm looking at adults. Don't send me a 2-year-old child who you think is Duane's. So my inclusion criteria is this: try and send me patients who are relevant to my study. Display it, remind, talk to your guide. Every guide is very busy. He's not just going to always remember your criteria. So always interact with them, go back to them repeatedly, especially if there is a delay or a lag in the way your recruitment is going on. Make a performer for each patient and fill and file it. Create a master chart, preferably as an MS Excel side by side. Nowadays, some very great protocol programs are available. You feed in your protocol, you feed in your performer, and you can fill it directly on that, and it automatically generates an Excel file. So great programs are now available and technology can help you. I'm talking about my time, and I used to, fill by hand, have a chart, make a big chart paper and keep filling it, making sure that I have all the entry points and follow-up points. But now it is much easier. You can keep a track of the patient. You can put reminders for yourself and the patient in your phone that this patient has to be contacted or he's missed a follow-up period. And of course, wherever you have done an investigation, retrieve the data immediately or as early as possible. We've suffered when you are unable to access it, when in your last few months you're struggling, you don't have the time, or the machine has crashed, or the data is corrupted, and then you're really struggling to get access to that lot of data that you're supposed to. So a couple of hours a week, just keeping track of how your patients are performing and how your data is being collected and entered will go a long way in keeping your study organized. So collect data, organize data, keep it presented in form of tables and graphs, finally analysis, and then interpretation. So these are the stages of research. During your study, these are the important things: collection and organization of data. Of course, ethical principles are very, very important. Start from planning and extending to the publication part. Ethical guidelines control each and every step. Remember, you must protect the participants. The participants are human beings. We need to be very, very sensitive. I would never like me or my close relatives to be part of a study where they are not given respect or due recognition of their contribution to the research that is going on. So always treat your patients with respect. That is the bottom line before any study or any research can be done. Common issues are informed consent. We think, like I said, we think that informed consent is not important or patients will run away. It is no more true in today's world. It's very important to have comprehensive informed consent, not only so that the patient knows what's going on, but you are also protected in the long run. Confidentiality of the data. Do not expose identifiable data to anyone. It's very, very important. This is a right of the patient. that nobody else should know about his or her disease to anybody else. Of course, because we are sitting in crowded OPDs and all, we think that, because I'm discussing the patient's condition in front of a lot of the other people, it's probably okay to, discuss these things openly. But truly speaking, wherever you can manage it, and especially for research, maintain the confidentiality and the dignity of the patient that you're enrolling in the study. Do not fabricate data. Adjusting data, making up data, all these things, not only are they poor research, but I'll tell you, you will miss great research just because you thought that your results should be like this and you are making up your data rather than actually finding true results and trying to understand them. Great research comes from, or new advancement comes from, actually looking at data in the way it is coming. If you do your research genuinely, really following what you plan to do and entering your data or your research findings in a true manner, I can assure you something new will definitely come. Sometimes it may not conform with what you expected, but even these may be actually the basis of new ideas that may give rise to an absolutely new thing that may actually be path breaking. Do not definitely manipulate your data again. That is not what is actually representing. And then plagiarism. Do not take anybody else's ideas, copy their research into yours. And of course, when you're writing up your research, whenever you write something, please give due credit and recognition of that person's work. Research misconduct does not include honest errors or difference in opinion. Remember this. It's not wrong to be different in your results. Do not think that my results should conform to what previous publications existing. My study data, my population, my investigations, my group of people may actually be different and give rise to something absolutely new, which may give rise to some real new findings that I will in future be very proud of. Again, never fabricate data, move data in a sense, kind of change it to conform to what you think is correct, manipulate your images or hide bad results. Again, do not be ashamed of a result that it is not conforming or it's not a positive study. Negative studies have sometimes changed our clinical care or, really picking up something that has changed, management processes. Hiding bad results, the greatest ideas may actually give rise to a lot of problems. And if we try to cover up, fudge complications of problems, we in the long run are allowing a bad idea to go on. The most, blatant and probably an example that, all of us have always read is the thalidomide tragedy. If you remember, thalidomide was a path-breaking drug. And if you actually go back to read the study, it is unfortunate that thousands of children were born just because of this drug. It was a wonder drug to prevent morning thickness, but thousands of children were born with abnormal limbs and so many developmental issues. Unfortunately, because bad results or side effects of this drug were hidden, were fudged, because people just didn't want to believe that this is wrong. So again, do not hide bad results. Do not be ashamed of a negative outcome. And then finally, writing your thesis is the bottom line. It is the most important part. Like I said, presentation makes all the great things. Organize your results in identifiable sections. Tell what was found at the level of significance, how important it is. Try to make it presentable in the form of tables and graphs with good suitable headings and proper ideas. Discuss well, summarize, compare with previous studies, and finally talk about the drawbacks of the study and the implication of findings. And your conclusions should pertain to the findings of the study and not be outside. And summary should be stand alone. Often as a reviewer, I just first go to the summary and to find out what is in the thesis and then go in the detail. So you should be able to summarize in a very short 1 or 2 pages everything that you have gone through. And writing up your thesis, finally, the bulk is about, what thinking about what you're writing, and then there are small areas about actually writing. So think for a long time before you actually put your pen to paper. Time your program, time what you are going to do, because you are going to spend the bulk in your collection of data and a small amount of time in writing. So think about it. A well-written thesis should be concise but clear. Avoid long sentences. Format it well. Give good attention to detail, and materials used for assessments and all should be provided always in the end. And finally, thesis is not just writing a thesis. It gives you an opportunity to publish, see your name forever appearing on the PubMed, on Google. And these are important things. And as you're doing your study, you come across some interesting cases or case series, you may actually publish a lot more than your thesis. It's not a burden. It may not actually be boring. It's the beginning of a career of research that every ophthalmologist should indulge in, and can take you to newer heights and really do path-breaking research. So all the best to writing your protocols, making up a good idea, and finally going on to do great research as the start of a great career in ophthalmology and research. Thank you.
Wonderful. It's a really wonderful talk. And Dr. Chandana Chakrabarti. Chandana madam. Okay, now I
Hello.
invite yeah, ma'am, you're slow.
Chandana.
I told you.
Great to see you.
Thank you, same to you.
We struggled in writing the thesis together long years ago.
Yes. Listening Rohit is always a pleasure, because the way he delivers the talk, that is initially I was thinking कि ये क्या सुनना है, इसमें तो बहुत सुना है. But when you listen, that always some new input you will get, and that will hammer in your mind. That is the important thing. So I request Dr. Sarmistha. Dr. Sarmistha is here. Hello.
Yes, ma'am, I'm here.
Please give us some feedback from your experience.
I had a lot to learn from what Dr. Rohit has said, and we have also been working, but we need more of input from the postgraduates themselves, the people who would be really working practically. And my little advice after many years of service is that I would like the students to first of all give the topic, and then they have to make a protocol that is similar to a master chart, so that the points in which they will be noting down in their records should be already ready. So they should know what they should actually be searching for or studying on. This is a little from my side.
So Dr. Rohit, I think he has told mostly.
Yes.
Rohit, you want to give anything, any take home from this?
My only take home is that, really, as Dr. Sharmisha has said, and I think all of us who've been guiding research or doing research, is that actually research is very, very rewarding. I mean, being a doctor itself is rewarding. It gives us a kick every day. You do something little, treat a good patient, and the end of the day, you are happy because you've made, one life better. So same is with research. One idea, maybe yours gets published in a very average journal, but it's very, very important that a small idea should be pursued and published so that somebody else can take another step forward and take your idea to the next height. So enjoy your research. It's always enjoyable. One of the best parts of, being an academics is doing research, guiding residents, and being a part of some wonderful research that we get to do. And every individual person on a daily basis should get involved in research and learn from every case. Every case is a research. It may not be a great, big, multi-centric trial that you're involved in, but every patient teaches us and therefore is a research. So involve in it, enjoy it. They are always the most pleasurable parts of our day, at least as as a clinician, as a researcher, as a teacher. So
PGs are listening. Any PGs here?
There are, sir.
Ma'am,
So just to add.
Can we listen and something on this particular, because Dr. Shormishta, what she is saying, that it is very difficult to make these PGs involved. So anything you want to share with us about this particular issue?
Involving residents, big challenge. But again, nowadays I've learned this, that, you cannot scold, you cannot, punish, you can't say anything. Gone are the days when you could, show your anger even in the round. So encouraging, interacting, showing them the beauty of the work that they're going to do, and finally getting them to present even intermittent, part results, so that they are able to understand what they're doing is impactful. So every few months, get them to analyze their research and recognize that what they're doing is something very interesting, or what they're coming out with is, has a bottom line, some new finding or something. So that's the best way to keep coaxing them to, get involved and continue to do, their thesis work. But yeah, it's a very, very big challenge, especially when they're always so busy.
But Dr. Shormishta, one thing is there. Protocol is means you have to do something for your MSMD. That is a must. So that PGT cannot just avoid.
Yes.
That they cannot just avoid. That is a must. And once they do the first in his or her lifetime, mostly, then I think some of them, not everyone, 100% will definitely not be involved in the rest of the life. But I think at least 25 to 30% PGs, they will be involved in future also, in future this thing also. And during, can we just come to this protocol writing and some other nitty-gritty of this? And Dr. Anita is here. Can you tell us add anything new?
Yeah, I was just wanted to share my experience that, the candidates, they do the data collection, they keep postponing it towards the end of the study period. So it should be in continuum. They should be, and we have to, I noticed that I have to prod them. Are you collecting the data? Have you put the, the inclusion, exclusion in the different OPDs? So it should be in continuity. They should retrieve the data, as Dr. Rohit said, because sometimes the system just crashes. So it should be a continuous process rather than just postpone towards the end of the study period and then in a hurry. And then that is when the fudging starts, and then the rest of the thing starts when you have 5 cases, you make it 10 and all that. So they should be involved right from day one. They should start with and then they should start recording it in the Excel sheet and, and even if another thing I want to say, that even if the hypothesis turns out to be wrong,
Yes.
Their hypothesis is not really proved. Even that is important. What will you say, yes, Dr. Rohit? You're not
Definitely.
That is also research. I mean, so that people don't go around doing the same thing all the time again and again.
Definitely. Thank you, Dr. Anita, for your input. Dr. Rohit, please. Anything you want to add on this particular note? I think we are basically talking today about the writing of a protocol. So the thesis writing will come after this. Now we are writing how to write the protocol. I think this protocol writing is very, very important. This is the first step of our doing the thesis practically, actually. And everything, the nitty-gritty of your research work should be very, very clear to the candidate and to the guide also. That is very important, because repeatedly you have to check it. Everything what I have told that I will do, whether the facilities are there in our department or not. The materials and methods, everything, whether the things will be sometimes it has happened that in the middle of doing a thesis, you have to abandon the thesis because the materials has suddenly stopped coming. So these things also are very important when you are going to start, whether it will be a continuous flow of the patient. A patient, you will get the adequate number of patients in your center of this particular type. Maybe you have done a very nice this title. I will do this. But suddenly you find that no, I'm not getting this much of patient or this much of the material. So this thing should be very clear. And in that particular note, I will say the guides have got a very, very important role. Very, very important role. The publication and all that will naturally be there after if you do a good work. But during this means when you are making your building up and that time it will be the ethical committee clearance. Before taking the ethical committee clearance, you have to ask your seniors, then you go submit it to the ethical committee clearance. You can talk to many of your seniors whom you feel that they are, you can depend on them. That see, I'm going to be this orchestra, or madam, do you think this is okay? These are all for our postgraduate trainees I'm talking. So Dr. Shobita is here. Dr. Shobita.
Yes, yes, madam.
Can you give us some?
Actually, the
madam.
So
yes.
we are giving the thesis at the first year. So how to select a research question, that is the main problem actually for the postgraduate. A good research question. So selects the topic and with a good research question we should be selected. That is the problem for the postgraduates by giving the thesis.
In our center, I mean RIU Kolkata, in our center, what we do is that first hand, we just give them liberty. See, you find out your own topic. So they get motivated. That is the first thing that they will be motivated. But at the end of the day, when you ask them that you come with 5 or 6 topic, what you want to do, and then they will come with you. They will come to you with that 5 or 6 topic, and then we have something in our mind that this year we are going to give this preferably. But remember what I have seen. Few of them, they are actually very good and they have some idea of new things also. That also we cannot ignore. We cannot tell everyone that you have to do this. In our time, I remember in RP Center, Rohit may be knowing that thesis, regarding the thesis topic, we were never asked that whether you will do this or not. They used to give us the topic, the allocation of the topic. That is according to the, I don't know that is the right way or wrong. Rohit, is it the same wrong also?
Now, I mean, of course, we randomly get them selected so that there are no preferences. But so they randomly get the guide. After that, of course, it's guide based. Like, ideally we ask like I said, they come to me, I say that, this is my specialty, go see what you want to do, if you have any ideas. And then they come back. And as you said, there have been some very, very bright students. One of my students who's now, in the US doing some great research came to me, said, actually, I wanted to do neurology, but, I didn't get neurology. So I'm stuck with ophthalmology. So I said, sure, let's do neuro-ophthalmology research. And all his study was, on Parkinson's disease and got published like beautifully. So some of the kids can be really bright and, you need to coax their area of interest and move forward.
Yes.
I mean, you need to involve them in the decision-making process so that they become participant to the research.
Yes. So this is the answer to Dr. Sharmishta's question also, that the students are not actually being involved, but they will be definitely involved. At least 75 to 80% will be involved. Once they submit it, they know that I have to work on this. But yes, some of them are very clever, actually, intelligent. They think I will manage it, I will do copy paste everything. But that is our responsibility to keep a very close watch on them, what they are actually doing.
Yes, so these ideas also they get from their seniors. So they should not be blamed.
The seniors. They always, I remember Some of my seniors, they used to just tell me, Dr. Chandna, why are you wasting so much time in an emergency doing this 24 hours annual variation and all? Why are you doing this? Forget all these things. This was also told to me. Yeah. But seniors, remember that all the seniors are also not so bad. Some the seniors are also there to help you also. They are there to help you also. So that also you have to remember. Another thing, Rohit, so I think
inputs from postgraduates, madam.
We'll take that. Writing protocol. I was just going through an presentation. In protocol, at the end, when you are writing the summary, you just make a flow chart in your protocol summary. That is a very good idea. That is very clearly 1, 2, 3, 4 step by step. This is my protocol, the summary of the protocol. This idea I just got today, but I think this is a good idea because the people now are very interested about this flow chart and all these things.
Yes, absolutely.
Yeah. Let's take some inputs from the students then.
Students, please.
Dr. Shruti, would you like to say something? Why don't you? Have you taken the topic?
It's a very educative session actually. We are, as first years, we are listening that our second years, third years, they're submitting the thesis or they're working on their thesis. So it's like we were wondering what is this. Rohit sir gave a very clear idea. Very clear idea, and it was very informative, sir.
Thank you. All the best.
Have you started writing your thesis protocol?
No, sir. We have only joined this month. It's been 1 month only.
Okay.
So.
Okay. No, then you have not decided your topic.
No, sir. No, sir.
Okay, Dr. Sophia. Dr. Lihalin, how long you are in the as a PG?
You can ask Rohit sir. He just today we had a discussion regarding this.
Yes.
Anything you want to know? Anything you want to know?
Yeah.
Any PGs? If you have got any question to Dr. Rohit.
Good evening, respected sir and ma'am. It was really an informative session for us as we are first year. We have recently joined, and we really need to know about this thesis protocol and all.
Sophia, would you like to say something?
Good evening, sir. Good evening,
Yeah.
all. Sir, it's a very informative video for me, and I am just 2 months old. I have just joined, so
Okay.
but thank you, sir.
You don't have to just keep praising. It was great. Ask questions if you have any.
Can I, Rohit, can I just add something about the writing of the references and all?
Have you put down the point?
Reference writing.
Yeah.
Reference writing is actually what are the parts of the protocol where you are going to keep your reference. One is the introduction part, one is the your discussion part, and also sometimes in the materials and methods parts you can keep some in references. When suppose you are a certain particular methods you are going to follow, which has been given in another article, and you are going to just follow that particular methods. So in that you can give the reference in your materials methods. That I am doing this materials methods according to this particular article. So these are the 3 parts where references should be written. While giving the references, Remember, in a protocol, only 8 to 10 references maximum you can keep. Another thing is that try to keep as much as possible the recent articles as much as possible. And if recent articles are not available, sometimes many times, at least 3-4 recent articles you have try to find out. Books and all you can take. Sometimes you may have to refer these books sometimes also, but try to, of course, the recent articles must be there. So 8 to 10 articles, recent articles, and the parts where you are going to insert this. Rohit, anything?
Absolutely right. I think you have, I mean,
Mr.
key point
Santosh?
of this is this.
Yes,
Dr.
yes.
Santosh,
Yes, sir.
But
Yeah,
discussion
like
is
to
not a
give
part of the protocol.
Yes, sir. I'm here.
yeah, your remarks?
Everybody, I think, given their inputs, and I'll just summarize, like Dr. Rohit very minutely discussed all the aspects. Just 5 points I would like to tell the residents that your guides will decide about the feasibility, rationale, and also the subject. But you need to do your homeworks. As discussed, you have to properly write the protocol as well as follow it up every day, not last minute you have to compile and try to put things in place and try to do all those sorts like falsification, fabrication and all. So at least coincidentally, we had 2 residents who we today carried out our scientific committee meeting in our hospital. Dr. Rohit, who is also a participant in this program, and I was really trying to match what we did and what Dr. Rohit is presenting. I think I also learned few points, and definitely where to go. And every resident should take it as a first step for research, and they are going to carry the thing throughout their life. That is most important message I want to give. So do it honestly, properly, so that you can enjoy throughout your life the fruit of the first research you have done, and that will really show the path for the rest.
Thank you, sir. Thank you very much. Dr. Subudhi.
Yeah.
Dr. Subudhi, this honesty and all, and all, I think it is very difficult, no? It's very difficult.
Not difficult, madam. Actually, if you just like Dr. Rohit said, even if you are not like properly.
But from the big means they are newcomer, they should do it with 100% honesty. This
and
we
should be properly.
This should be our motto.
Yeah.
They should
we
learn.
Should be also following them properly so that they remain really honest and do the research.
And another thing, what Dr. Rohit also trying to give importance, that is the inclusion-exclusion criteria. This is one point which I have seen almost almost 75% of the PGs, they are writing in a wrong way. The inclusion, we have to remember that inclusion criteria is something where all this, what he was telling, 18 to 16 years, 60 years, all will be involved with the diabetes mellitus type 1. But exclusion criteria, we cannot just write below 18, above 16 with type 2. That is not our exclusion criteria. All those patients who will go through they pass the criteria of inclusion, but for some other reason we are excluding him or her. That is the thing. This is one thing I have seen many people, they write it wrongly actually.
Not come.
I think
Anybody want to?
any postgraduate students, would you like to ask some questions or would you like to have some comments? Dr. Rohit Chavan.
Sir, I have a doubt.
Yeah, please.
Yes.
Actually, there are so many literatures are available. So how to find in which line we will going to study? There are so many literatures are available. Some are fake literatures also there. So when you give a thesis to a postgraduate, they are giving some of the topics. They without any conclusion actually. So how to find that it is a wrong one? And they show some of the articles with that also. So how to find out that this is a wrong one or a right one?
So the first thing before you start or they start the search. So when you decide on a topic for which you are going to do literature search, the key point or as a guide or as a person who's going to start is that the key words are the most important. When we write a paper or when we write something, we're always asked to write key words at the bottom. So sometimes we feel that why are we asked to write 5 key words for this paper? But those are the key words that are going to be picked up fast in a search. So the important thing, whatever title you decide, so that has to have, you have to discuss and tell the resident that these are the keywords you type when you are searching for relevant literature. So like you said, I mean, the study is on outcomes of medial rectus versus superior rectus transposition and Duane syndrome. Now the keyword can't be Duane syndrome because or strabismus or because then they are going to get 10,000 articles. So you need to have keywords where you are going to discuss with them that management Duane's or superior rectus transposition Duane. So keywords have to be discussed. You're right. It's very, very important because they will miss out the relevant studies and come with studies which are not making sense and say there is no literature on this. Whereas this has been well evaluated, you are doing it in a different condition or whatever. So important first to highlight the keywords, and of course I would tend to if whenever needed go back and check myself that there may be some studies that they have missed. So actually tell them that these are studies, and then identify the key recent studies and then do cross-referencing in a sense that identify where that article has come. And of course, highlight or look at key journals, important journals like ophthalmology, like survey, where, recent and well comprehensive, well done articles are available. So, cross-referencing from there, reading, again, the importance of reading the whole article so that where are the other similar papers that have been done so that I can take them out. So again, the protocol is the most important. The crux of any study is the earlier literature that you have fleshed out and been able to evaluate and be able to give a comprehensive availability of information, and then go on to say that this is not known and this is what I want to answer.
Writing a
good review article
is important actually.
No, reading a good review article also will help you in detecting and selecting literatures.
Thank you, Dr. Rohit.
Thank you. I think I will do the last.
But the best thing, the most important thing, I started from the very beginning. If you can possibly get a good guide like Dr. Subudhi or Dr. Sabis, good persons who don't, tell you or pain you or make your life difficult.
Thank you, sir. I think I have to do the last part.
Lenient guide. You mean lenient guide?
Yeah. So before that, I request Mausam to play the video for the host today. Mr. Mausam, are you there? Thank you, Professor Rohit. Really wonderful talk. As I told you before, we have heard at least, I think this is our third talk we have done. And today's talk is really wonderful, very simplified, very comprehensive. And I think people have understood very well. And of course, yeah.
Sir, just one point, sir. Just one point I want to highlight is why we are conducting this program is because within next 3 to 4 years, we expect good number of very good publications from all of you, so that we'll feel that all these efforts by us is successful. So that is the reason why we are conducting a discussion with all of you. So we expect after your completion of the thesis or your post-graduation, we are definitely going to get good publications from each one of you. So you have this in mind and apply all those that has been discussed today in writing your protocol, so that your thesis will be of a very good quality. It is not that you have to manipulate data and other things. If you do it properly, ultimately a good paper will come from you only, from the initial part of your ophthalmic career. Thank you all. Thank you very much. From EIZOC, I thank you all very much for attending and participating in this program.
Yeah. Thanks to Dr. Rohit. And of course, Chandana Madam, thank you very much for moderating the session today.
Thank you.
Really involved everybody.
Taking so much of interest.
Yes. So, thanks.
It's my pleasure.
It's always a good to
Anita, thanks Dr. Savita.
Yes.
Really, and Dr. Sarmishta for, I think, continuing the talk and having a lot of discussion today. And of course, the beneficiaries today, all the postgraduate students, no doubt they're in the first month of their course. But however, it's a beginning. So definitely we'll be listening to, again, some other topics.
At least see that your new batch postgraduates are writing proper protocol, at least of 10 to 12 pages. No, I know we remember our time, we have submitted the synopsis of 3 pages. So that doesn't include everything that is to be there in the protocol. Once a protocol is properly done, half of the thesis work is done.
Today's talk is very simplified.
It's our responsibility to guide them properly. It is our responsibility.
Yes. Not that they are not involved. We have to involve them. We have to involve them. We have to put the task, give the task.
So this talk was important for both the PGTs and for the guides, for us also. So thank you, Dr. Rohit.
Yes.
Thank you for the opportunity.
Because we are coming up with the protocols, so it will be all fresh in the mind.
Thank you very much. Thank you, everybody.
Thank you, everyone.
Thanks,
Thank you.
Pharmaceuticals, for giving the platform. And thank everybody, all the viewers. Once again, we meet after 15 days for another talk, our ORTS talk. Thank you. Good night.
Good night, and thank you for the opportunity, sir.
Right.
Good night.